Hi, everyone, and welcome to the show Beyond the Checkbox. I am your host, Dr. Ryan Todd, and this is where we try to talk to the world's leaders in mental health and HR, try to get a pulse of what's going on in the HR world, how people are taking care of other people, protecting their people. So we had a good opportunity to talk to Tammy Sergie today, and she is the CHRO of a large healthcare conglomerate called EHN, and they have a specific role in providing mental health supports. So she is a caregiver for caregivers. And I think that's always an interesting conversation because HR in the medical field is a whole other layer of complexity. And my takeaway from my conversation, which was sweeping and I think really effective, was there's a lot going on in HR right now. Cost of living, intergenerational communication is a huge issue right now. We're talking about doing way more with way less in HR. We're trying to prove HR as a business function, not a cost center. We are trying to meet people's mental health needs across multiple generations. So we covered all that. I had some major takeaways, especially around talking and communicating with different generations and understanding those different generations. And I always get that question whenever I do a talk. How do we communicate from baby boomers to Gen Z, Gen Z, Gen X, Gen Y, the MTV generation, the silent generation? How do we communicate across those swaths of individuals? And she gave some really good answers for that. And I hope you enjoy that and can have some takeaways as well. So thanks again for joining Beyond the Checkbox. And I hope you enjoy the show and join us next time as well, where we're going to continue to talk about mental health in the workplace and bring in frontline leaders. I'm Dr. Ryan Todd, a psychiatrist with over a decade of experience. And in this series with leading experts, we will explore the complexities of mental health, breakthrough therapies, and today's hottest topics. This is Beyond the Checkbox, Mind Masters. We saw a couple of things that you had posted and a couple of awards you had won, and you've been in this industry for how long now? 20 years? Did I read that right?
Yeah, I've been in HR for, I think, a total of 22 years. I started out very early, very passionate about people, and that naturally led me to mental health and working in healthcare. And I've been in healthcare in particular for luckily 4 years, and it's just a very different world. It just takes the human psychology and the employee relations component of people side of the house to a whole other level. It's just fascinating. The situation is so dire and so little information out there around where we are as a country. And the state of mental health is just, we're not talking enough about it as a country, as a profession. And so I'm excited to be anywhere I can be to spread the word and create a higher level of awareness. And very excited to be a part of this event.
What do you think's going on there, Tammy? Like, why do you think people aren't talking about it enough or not talking about the right things enough?
We have a lot of societal issues to address, and they're overwhelming and they're large. And there's only so much time in the day and so much passion out there, so many resources and tools and investment and interest from some of the critical decision makers that we're addressing all we can as quickly as we can, but you can't contribute equally to failing retirement system in this country. You can't address the demographics changing and impacting in a very devastating way the labor pool that you're dealing with. You're addressing leadership gaps as a result of baby boomers retiring. You're want to play an active role in social contributions and have a meaningful diversity and inclusion stance as an organization. You're working against the cost of living and inflation and trying to retain your employees and help them actually break even and and survive in poor economic conditions. And you're doing all of that simultaneously with depleted, unsophisticated, and unprepared leadership organization that is stepping into really, really big shoes to fill of rapidly retiring baby boomers. And so I think we're doing the best that we can, knowing that there's just so many big things for us to address today. I don't think the corporate Canada has ever been more complex than it is today.
I was reading something about burnout with HR professionals, and it was something like, not something like, it was 91% of HR professionals don't feel supported at work, and 87% said they were experiencing symptoms of burnout. Those are, and then there was a note in this article, and we can try and pull it up, that HR and legal profession were the two highest risk industries right now in the country. And by and large, it seems like you're asked to do way more with way less. And I know everyone's asked to do more with less, but it seems like HR is asked to do way, way more with way, way less. It's always a cost center, and it's never seen as, okay, we're actually improving the profit or the revenue of the business. So why continue to invest more? Is that too obtuse of a thought, or is that true? Are we not investing enough in HR?
I think HR is very diverse, right? As a profession in general. Bottom line, the responsibility over people is huge. Any business, whether it's a commodities business or a service provider, it stands on the shoulders of the employees. And I think, to answer your question, I think businesses and um, leadership really needs to think of HR from a slightly different perspective. Investing into HR related programs is investing back into your employees. It's supporting the most meaningful um, contributors to the success of your business. Engagement has a legitimate ROI. Turnover actually does cost businesses millions of dollars. Loss of productivity, absenteeism, higher levels of disability, um, uh, burnout across your employee population. All of that has costs associated with it. We have not learned how to effectively measure these on our balance books. I think there's a lot of discussion, there's a lot of forecasting and estimation of those costs, but they're not as tangible and not easy to prove. Um, but there's tremendous value in investing into the employee experience and therefore the HR organization that drives and champions a lot of these initiatives within the business.
We just pulled out some stats here that we would talk about. The most striking is the attrition for nurses under 5 years of practice is 50%. So that means like we're literally losing half of the nurses as they come in. And then what you're saying on top of that is engagement is incredibly low. Can you help us understand engagement? Because I want to talk about engagement as a proxy, but what
Yeah.
does that mean, engagement?
Engagement is how dedicated you are to what it is that you're doing for a living for this particular employer. It's the level of commitment. It's the desire to go above and beyond minimum expectations of your job. And I think when we think about engagement with just what I described just now, you think in healthcare, that's like high up there. We went into this field to want to help people. And so it's very natural to assume that that purpose is generally there. And now seeing very low engagement levels across the nurses and counselors, clinical organizations is quite shocking because it's not natural. And so as we look into it, I think the best way I can speak to this is to go back to COVID. I think a general Canadian had, an experience that sounds like this. We're at home. Um, many of us sat in front of the screen for a lengthy period of time. We worked virtually. We all recall washing our groceries. The extra support we needed to give to our dependents, whether parents or children, navigating through the virtual environment of what the world has turned into overnight. For healthcare professionals, their experience was very different. They were putting on masks, in many cases, hazmat suits, sitting in their cars, risking their lives, getting out of their homes in the most scary conditions with a lot of unknown, where most individuals had the safety of their home. These individuals had to get out into the danger zone, still worry about washing their dishes and groceries with soap, and still trying to live like an average individual would. But during the day, they got out, they drove themselves to work, and they physically were present to support people that had symptoms, that were in distress, that were panicking about the experience that they were going through. And so we hailed them all heroes, and we had posters across the city, and we certainly came through and supported the healthcare and first responders as a community. But their experience was so tough that when we started recovering and coming back into the reality post-COVID, they packed a lot of hurt feelings through that very tough phase for our communities. And so they were burnt out. Many Canadians now look back to COVID and wish, I wish we had another pandemic. I've seen things on social media. I'm missing, my cozy time at home. Well, these folks did not experience any of that. And so the animosity and hurt feelings, they're there. The cost of living goes up. The economy is unstable as it is. They're struggling like an average Canadian with paying bills and being able to afford housing. And the hurt feelings are still there. And so I think the experience collectively is pushing more and more individuals that came into the medical and healthcare field because of a mission away from that field, because as much as we put on posters across the city, thank you for all you do, they didn't necessarily feel that gratitude in their experience. And so I think we had a tremendous number of nurses actually fully exit the field post-COVID. Very, very early retirements. Decisions were made to step away because it had an impact on their mental health, and they were bringing it home, and they're experiencing it on a whole other level than an average community member.
How long does that last post COVID? The hurt feelings and that kind of post traumatic piece and the attrition. How long do you think it'll last?
I think what was interesting is, I don't know if you recall the Great Summer of Great Resignation. I think that was late 22, spilled over into 23. I think a lot of people made decisions that they were ready for change post-COVID. And that kind of shifted the whole dynamic in the market and had impact on healthcare as well. Halo effect on the nurses. Now maybe I should go and look for a job as well. So we had a lot of movement. People picked up and kind of moved across. So there was not a lot of change. There was a lot of change. And then we were experiencing some level of stability. And I think with the current economic conditions, we're seeing it finally stabilize from a attrition perspective. We're seeing a lot less turnover. Folks are just saying, I'm going to wait it out. The economic conditions are not favorable for me to make those career decisions at the moment. And we're seeing the impact on turnover going down. So I would say it took a whole 5 years. It was a journey in terms of our people movement.
It's interesting to me because there's a bunch of different emotional experiences that people go through when choosing a job, staying with a job, or leaving a job. And What I hear you outlining is that people made an emotional decision to say, I'm leaving because I didn't feel the gratitude. I feel burnt out. I didn't like that experience. It was unstable and dangerous. And now, even if they're feeling that, they're saying, I don't know what's on the other side because there's no jobs. And so they're
Hmm.
staying with it despite that discomfort.
Yes, I think we're seeing a lot of that happening right now for sure.
What are you working on? What are some of the initiatives that, I mean, you're interested in, excited about around mental health? You've been an advocate, you talk about it, you've implemented a handful of things across your organization. What do you think has had impact? What are you seeing actually working in this industry when it comes to mental health?
Mhm. I want a lot of our discussion around inclusion and diversity to absolutely include mental health. I think the employee experience needs to be a lot more nuanced, and mental health is at the core of a lot of our experiences as employees, and a lot of the work that the employers can truly make an impact on. We are operating in a very complex workplace. We have four generations actively working side by side with one another. We have two halo generations around us, and silent generation is still sitting on board of directors of many businesses. You have baby boomers, the rapidly exiting generation in the workforce. You have the um, uh, Generation Z entering the workforce more rapidly. But you have a much smaller generation entering one after another, just because of the size of the generations. Now they all communicate very differently with one another. They have very different needs. They've grown up very differently. They have very different aptitude. They have a very different attitude. They have a different perception of the support that they require. There's a different perception of what is a privilege and a benefit and what is an entitlement. Younger generations uh, grew up very differently than baby boomers, and they grew up with one of the highest divorce rates the country has ever seen. A lot of these kids have been exposed to therapy very early on in their lifespan. When they're entering the workforce and they're experiencing life and you know challenges of being a working professional, their expectation is that they're supported very differently than what we have seen with baby boomers. They're expecting that the employer has made investments into therapy, that there is dollars available to support them in that level of support. Whereas traditionally employers are continuing to think, okay, I have multidimensional employees. They're very complex, multiple generations to cater to. I have a finite pool of money. Let me do a little bit of work in the pension space. Let me make sure I have my physical healthcare supported through benefits, and none of them are negotiable. They are a baseline for employees. They're expecting that this is a part of your offering, as any good business. Let me invest a little bit into something extra, right? Based on the employee mix that I have. Maybe it's pet insurance, maybe it's orthodontics, whatever. Maybe we're super excited about massage. So we're trying to cater, use the same pool of money to spread across variety of different elements of total rewards. And then in mental health space, I think we all recognize the importance of it, but we're quick to just check off that mark by saying we have EAP, the Employee Assistance Program, broadly, feeling trouble, and you want to talk to somebody, you need support, it's there. The employers are just now starting to look at investing a little bit more into therapy. Let me make sure that that pool of money is large enough that my employee, if EAP with the mild mental health support that they need support in, um, leads us to more services that are required for my employee. Um, Let me have, $2,000 available for my employees for the therapy. And that's where we stop. The challenge is mental health is evolving into a very complex matter that impacts all fabrics of our experience, not just as employees, but as as people out there on the street. Um, we're we're seeing one of our generations rapidly shrinking, not because the lifespan and medical advancements are not there. I'm speaking of millennials, but because of opioid crisis and suicide rates going up.
Wow.
And so there's material impact in employers looking at investing in mental health area as a preventative measure that we're not seeing at the moment. And as a company, we want to make sure that a good clinician has a clinician. We're investing dollars and making sure that we've got services available to our employees, so they need to speak to somebody. EAP is a baseline. We'll have dollars invested into therapy as a part of their group benefits. We're making sure that if an individual is in a moderate mental health space, that we're able to offer treatment to our employees and support them on a much, much deeper level. We're investing into pension plans to make sure that their anxiety over financial stability is not there. We're looking at the employee experience and making sure that they're able to make decisions. They're tough today, which is, can I afford having a child? And investing into top-up benefits to make sure that they're not worried about paying their bills while they're on a leave after having a child. So we're looking to cover as much base as we can, understanding that multidimensional experience for employees is there. We can't address all of them, and all of them have an impact on their mental health, their engagement levels, and their headspace. The healthier we are, in the healthier space we are in our minds, the more productive, the more effective, and the more kind we can be to the people that we're providing care for. Being in healthcare, that's critical. We need to be connected to our passion to be able to provide the level of support that our patients require from us.
Tell me a little bit more about prevention. And I'm really interested about that because you mentioned it briefly in the context of the different generations and their expectations. And I guess the basic question is therapy enough? Many groups are investing in more therapy. EAP is a baseline. Is that enough? And if so, where do you go if not EAP and therapy? Kind of how are people thinking about prevention right now in different generations?
I think there's just so much to address, right? I mean, if we're going back to a philosophical, maybe even deep medical conversation around what triggers mental health conditions to pick up steam and become a part of the norm of a human experience. What 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 triggers what pushes somebody to have a substance use disorder? Right, and there's a lot. It is the economic conditions around them, it's the upbringing, it's the relationship and the support within that individual's family or the circle of care. It's the opportunities available to them growing up, education. I mean, there's just so much, right? And so if you take that and you plug it into, we're now dealing with employees. They come to us from all walks of life. They're all very different from one another, different generations, different communities, cultures, genders. I mean, there's a variety of different diversity aspects of your workforce. Add to that, some of them are working from home, some of them are hybrid, some are still going into the office every day. And then everybody's experiencing life slightly differently, but life is happening to everybody all around, all the time. It never stops. It never takes a break. How do you prevent the escalation? And to me, an escalation with mental health is the outcome of it is disability, right? Like the things have gotten so bad with an individual. We've not been able to support them through that escalation. And the outcome of it is they're not able to work, and they're no longer actively participating in the economy, right? Like they're fully disabled, not able to continue to carry their job. Implications financially: are they able to continue paying their bills? Can they continue to afford living in the house or renting a place that they're renting today? So if we can prevent the triggers, and again, going back to multidimensional setup of an individual, we're worried about many, many things, and they escalate and spike and trigger for a variety of different reasons. If we didn't worry and we didn't have the anxiety and sometimes at least the depression surrounding our financial situation as beings, could that help us be more engaged at work and do a better job and perform at a higher level, and then be rewarded very differently and have a very meaningful experience as an employee? That portion of the dimension that represents us. If we're addressing physical health, if a person was not experiencing chronic pain, and that didn't create depression and lead them to substance use, or making some decisions that led them to other things before you know it, the escalations and the condition is exacerbated. If the divorce rate in the country was not 50 to 75%, and you had more holistic families raising children and spending more time with the children, we didn't carry as much childhood trauma into the workforce. So the prevention it's just such a multifaceted element. As an employer, we can't fix everything.
Yeah.
But we can contribute to a variety of different aspects that could act as triggers later on in the employee's life to help support their navigation through that employee experience for the time that they're with us.
Yeah. I feel overwhelmed, the issues, right? Finances, childhood issues, divorce, labor. Like, how do you, as an HR professional, help your your peers, your leadership team? How do you help them focus on something and then measure the outcomes and have tangible results? 'Cause that's right. Leaders, I think, feel that they have a responsibility to protect their people. I don't think they have a great way to say, I proved that I did that. How do you help your leaders focus and measure?
I think one of the first uh, pieces that I think any decision maker or leader leading a business needs to start with is, do I understand the most pressing issue for my organization that I'm trying to solve? Because my perception, being exposed to a slightly different perspective of the business, may be very different than the employees themselves. And so direct communication with the employees is very critical. I think engagement surveys of any sorts, town halls, site visits, creating conversations directly with employee base to understand what their most pressing issue is and addressing it. But asking the questions in a way that you really have the variety of aspects that you're trying to solve is critical, because an employee anywhere you go today will tell you money. I'm not paid. I'm not paid enough. I need more. And that's because they're dealing with pressures of cost of living, the housing affordability, putting food on the table, supporting the dependents that they're responsible for. The cost of living is not a joke. It's never been. I mean, economic conditions has never been worse in generations. And when you start looking into just this and addressing just the compensation, you can go through several stages of addressing that. You can dump a lot of money into it. And many years later, you're going to meet the same people and ask them, well, what else can we do to improve it? Compensation will still be,
Yeah.
a pressing issue. Now, what's interesting is if you didn't ask the questions deep enough and you didn't understand the working conditions, many employees stick around because they love the relationship they have with their team, with the passion and mission that they feel connected to through the body of work that they represent. They may have an incredible relationship and feel well supported by their immediate manager. Again, a lot of leaders lose employees because of lack of that relationship as well.
Sure.
On the other hand, there may be other valuable things, like folks tend to work in the government for lengthy periods of time because the pension plans are phenomenal. So it's not necessarily the compensation that is reflected on the paycheck directly and deposited into your account, but there's other benefits that employees value. Folks may value just a mix of group benefits that the employer has been able to negotiate for them. Now, you won't get to the depth of what makes people make the decision to stay with an employer or leave for another opportunity until you dive into that depth with your employees, right? And so that dialogue is extremely important. Now, you take that, you bring it to the decision makers. Now they have their own view of the business, and they're looking at a variety of critical performance indicators of how they measure success of the business. They have finite pool of money that they've given you to address the investments into the employees or capital investments. We need to change the roof here if we own a building, etc. And then you can make a decision around, what that budget is for this investment and that, and how do we run this business in a fiscally responsible way. And it becomes a negotiation, but it's a dialogue that needs to happen. It's a dialogue that needs to be ongoing. I think if an executive team does not discuss people as an incredibly important topic in all of their meetings, they're missing the mark. I know AI is fascinating. I know we have a lot of expectations. We have an opportunity for tremendous amount of efficiencies in a variety of different jobs, and we're all very excited about it. But people will always be very valuable. And to many businesses that are service providers, like healthcare, you will never get to a point where you can automate the body of work fully and not require human intervention. And so the expertise of shrinking, one of our largest generations is retiring very rapidly, taking away tremendous amount of experience with them. And we have a smaller generation entering the workforce.
By smaller, you mean like literally the numbers are not there.
Yeah.
You have 10 people
They're
being
just not
replaced by
there.
3 people.
Exactly. So I think AI is not nice to have. I think we need it. We need it to survive. We actually need to automate a lot of administrative tasks because you've got one person replacing 10 that are exiting.
Yeah.
And I know we've looked at immigration to help support a lot of that. But well, think about it in healthcare. I happen to be in mental health. I can't bring in a counselor from another country as freely. They need to have a strong command of the language. They need to be very assimilated culturally to understand what a childhood trauma may look like of somebody who's grown up here. And so there are certainly industries where immigration could fill some of the gaps, but there are industries where the knowledge workers cannot be replaced through just inflow of humans from other countries. And so you need an element of AI to create efficiencies. You need to create and really nurture some of the phenomenal humans that you have in your business. And then you need to supplement it with, we're replacing one with 10. And so we need to be creative around how to multiply that one, how to extend the output. And so going back to your original question, why is everybody burnt out? Jesus. They're burnt out because for every 10 people leaving the marketplace, we're replacing it with one individual who is inexperienced and has many more decades to learn that subject matter expertise that they happen to be responsible for. And I don't know that we're moving so rapidly right now that we're not creating opportunities for proper mentorship and knowledge download. We communicate very differently with one another. The older baby boomers do not communicate the same language as some of the Gen Zs that, they have ChatGPT and they know how to solve the world. And then they get to the job and it's just not that simple. And it's an interesting time right now where how we feel in the state of our mental health is exactly what's happening around us. It's a very uncertain time with a big change in the workplace sort of happening all around us very rapidly.
Tammy, to wrap up, I need help on something. And the thing I need help with is I always get this question at the end of a talk. We have multiple generations in our workplace. How do we get them to talk to each other in a unified way, speak the same language? What do I tell these? I never have a good answer for that question. I always fumble through it. What is your advice around that? How do you coach people on how a baby boomer can talk to a Gen Z, millennial, Gen X, whatever it is? How can we explain to folks simply on how to speak the same language?
I think where we do a phenomenal job as species is absolutely communicating with one another. And I think over many decades of technological progress, there's different means of communicating with one another. But one very effective way of getting a very diverse group of individuals communicating is in person. So I know the world is very complex and we have hybrid work arrangements and we have some phenomenal people that they have to work remotely and we're lucky to have them. And there's exception to the rules, and there's some folks that are physically in the buildings, and everybody has their own life and schedule, etc. But the more opportunity we can create to bring the diverse group of humans together in person and have as many in-person meetings, opportunities to learn and debates and lunch and learns and training sessions, town hall where you bring people into the building, the human interaction. It's so valuable right now, and it's actually depleting, right? Like it's truly going away. And it's the preference in terms of communication for the baby boomers and the silent generation, and they possess enormous amount of wisdom and knowledge that is very, very important for the younger generations to absorb as quickly as we can. Now, there's always an opportunity to improve, but that base, starting from scratch, is not necessary. And AI is not going to teach us the basics. It needs to happen. That handoff needs to happen. Mentorship opportunities, have them working on projects. The interaction is absolutely priceless right now. So the more we can talk, the more we can get our companies need to think of opportunities to create dialogue among the employee populations in a way that they're solving business problems in project-based format, and we're forcing them to communicate and interact with one another and debate some of these important points. And it's tough to achieve because, again, we're moving very quickly. Every business has got a big agenda. And we've got multiple key performance indicators that are being measured, and there's quota and there's budget and there's expectations of all the leaders and all the employees. Everything's measurable, but it's it's time to slow down a little,
Slow down and
because
be.
that perfect time will never be here again. It's like I said, a finite opportunity, a very short window of time for us to really learn from one another, before AI becomes the main platform of knowledge, and human creativity um, gets capped.
That's a big that's a it's a big idea, but it's an important one, I think. And in person, I'm always encouraging my folks to, like, if there's conflict in the workplace, like, sit down with someone face to face. There's nothing that can replace that. I think it's even on the phone, which is more of an analog version of texting and Slack and Teams and email. So I'm a big believer in that. And yeah, I mean, thank you for joining us on the show, and we covered a lot of ground and a number of different issues. That my main takeaway is around the intergenerational piece. I think that is so interesting around communication and how we're perceiving different things, how we grew up in different ways, and how we need to have multiple approaches to those employees. We have multiple dynamics. We need complex and nuanced approaches to not just mental health, but all the benefits that we provide for our employees. So I thank you for continuing to carry this message and all the great work you do. And it was awesome having you on the show today.
Thank you. I appreciate you having me.